Now, after months of refusal, the Ford government, this is interesting, signaling that it could soon reverse its stance when it comes to paid sick days.
We are considering our alternatives now to deal with those gaps.
I can assure workers out there that I'm going to have their backs.
Okay, a change of tone here from Ministers McNaughton and Elliott yesterday. Prior to this, the province had maintained its stance that paid sick days were not necessary because there is a federal program that offers them. So what does the official opposition think about this potential about-face? Joining me now, NDP Leader Andrea Horwath. Good morning to you.
Good morning, Melanie, and thanks for having me on this morning. Looking forward to our talk.
Thank you so much for joining. So let's begin there, right there, with the paid sick days. You have been calling for this for months. Your reaction to this change of heart?
Well, I'm going to wait and see what the government is going to bring forward. I'm hopeful that they finally do the right thing and bring paid sick days to every worker in Ontario so folks don't have to go to work sick for fear of not being able to pay the bills. This is something that the experts have been calling for, as well as us, for months and months since the pandemic started. Well, in fact, NDP has been calling for paid sick days for many, many years now. In fact, the Liberals actually gave us 2 measly paid sick days, but Ford got rid of them as soon as he got elected. But the point right now is this will save lives. This will save precious lives. It could have saved many lives already and prevented the third wave from being just as horrifying as it is. And Ford had this advice many, many times, and he ignored it. Even Dr. Williams, who he claims to listen to all the time, said paid sick days would help. You know, he said that many months ago. So let's see exactly what the government's going to do. I hope they do the right thing because it will save lives. We have whole families in ICUs now, sick from COVID. That could have been prevented.
When you speak about those numbers, the Ontario Hospital Association actually just tweeted out the recent numbers, 72 new admissions in the last 24 hours. That is significant, a total of 788 patients in critical care. With some of what Premier Ford announced on Friday, some in which they've backpedaled on, what do we do? What more can be done? What would you do?
Oh, well, first of all, I mean, it was horrifying to see that the Premier's priority was to bring a police state to Ontario and close playgrounds. I mean, how wrong-headed is that? And who was giving him that advice? I certainly have no idea. And so, you know, the Premier, sure, he walked that regulation back a tiny bit and playgrounds are open, but so should all kinds of other outdoor activities be open. And that's what the experts are saying. On the regulation, I think the entire thing has to be scrapped. So if I were the Premier now, I mean, certainly we wouldn't be where we are. And I can say that for sure, because we would have implemented paid sick days and we would have listened to the science. We would have listened to the science all along. Yes, it means we have to invest by supporting the small businesses, the local companies that would be impacted, by closures. And yes, we would have to financially support working people who would have lost that opportunity for wages over that time frame. But it would have saved our healthcare system. It would have saved lives. It would have saved the horrifying tragedy that we're in now. So those are the things I would have done. Right now, I would actually start listening to the experts. So paid sick days, paid time off for vaccinations, repeal that odious regulation in its entirety, and really close all non-essential businesses and provide direct financial support to those companies and those workers in these next several weeks while we try to wrestle this virus to the ground. Because it is, as you said, 72 people. Those are lives. Those are family members. Those are precious lives that are in the balance, struggling to breathe in the ICUs.
We are seeing, at least within Peel Region and Toronto, saying, yes, they're going to close these businesses that are non-essential with 5+ cases of COVID-19. But then they are recommending that sick days be made available to these employees. But again, that needs to come from the province. Very quickly for you, before you go, you, along with others, calling for the resignation of Premier Ford. Do you stand by that?
Well, I mean, I really do believe that Doug Ford should not be the premier of this province. I've said that for some time now. He should not be the premier of this province. He's taking us in the wrong direction on many fronts, and I think his priorities and lack of leadership are unveiled even more in the way that he's handled COVID-19 and allowed, first of all, long-term care residents, 4,000 of them, to die by pretending he had an iron ring around long-term care when he didn't, and then waiting until we're at this point where again, so many people are in ICUs, where our healthcare system is literally overrun. Our healthcare heroes are exhausted and literally terrified of what the next day might bring. And now he's going to perhaps do something about paid sick days. Really, he should not be the premier of this province.
Okay, NDP Leader Andrea Horwath, thank you so much for joining today.
Thank you. Take care, Millie.
Take care. Right now, it is 8:10. We're looking outside. This is going to be a rough drive for a lot of people, Steph.